I can comment on that if you want. I mean, I would agree that scientists are probably a bit resistant to collaborate with ours. I think it's about showcasing nice examples that have worked and that involve a scientist that they can kind of familiarise with, and then the benefits it's had for them. I think scientists, certainly around the work I've been doing, knowledge exchange, they're always kind of like, what's the value of this to me? Is it going to be recognised? It's a nice thing to do, but is the university going to recognise my contributions in this by, promotions process or anything like that? So there has to be some sort of value, I think, and whether it's going to be seen more broadly in a scientific community, I think it'd be even more difficult than getting it seen by university within your, scientific community at scientific conferences. But I think it is changing slowly. There's definitely more funding and more people are doing it, but I think the funding's been the main stumbling block. The high funding that I've had for the bone crayon, it probably totals about £40,000 now. Actually, half of that's gone to the artist for her to kind of make the crayons and everything else that we talked about. So that can be a way to kind of get it started, because people need to be paid, basically.
I mean, our particular role, as we were artists and residents at the Manchester School of Art, I guess our sort of remit was about kind of engaging with different faculties, but also, it wasn't necessarily written as what we had to do, but we were really keen that students there kind of knew about these other facilities, and that they could then potentially kind of have the opportunity to use things like the equipment of the biomedical imaging unit and kind of open up that world to their sort of creative practice. That's really sort of important to us, and it was great because I know you do the road shows anyway, but I think they really kind of connected with that.
You foster nature, for sure.
We just have fun.
It's really magical, isn't it?
Yeah.
I think that's the thing. When you look at something under a microscope, you just kind of really opened up to a whole magical world. So I think it really depends on what your remit is, kind of part of that research. Because say the breastfeeding, the depression, postnatal depression, there's kind of quite a clear goal there, wasn't there?
Yeah.
So in a way, it's probably easier to sort of measure that at the end.
Yeah. I think that organisation as well, Breathe, who runs that project, they do a lot of work in, particularly in hospitals with the staff, and I know they talk about that's often a good place to start, because then the staff themselves experience it and experience how the arts can support their health and well-being, and then they become advocates in the hospital for when someone comes with an idea like, let's do a singing project for people with postnatal depression, you've kind of already got your champions in the university who've experienced it themselves.
I think from the researcher perspective, I think you've just got to put yourself out there that you're open to it, because in the unit we've never proactively gone out and looked for artists, but we have made it known that we are willing to and are very happy to work and engage with anyone and everyone, and they've come to us and said, can you help us? And we said yes.
Yeah,
so
to be fair, we did look for you.
Yeah. But
on you a bit there.
Yeah, so that put it on your web pages. That you're interested in exploring. Hashtag SciArt or whatever. And just make it known. It's getting it embedded in the culture. I think, as Claire said, is the challenge, that and get it recognised as something that is worthwhile to be done by the bean counters who face every day.